What is the role of the prefrontal cortex in addiction? Have you ever wondered how our brain makes decisions, especially when it comes to something as complex as addiction? The prefrontal cortex, often referred to as the brain's control center, plays a vital role in this process. It is responsible for higher-order functions like decision-making, impulse control, attention, and working memory. These functions are essential for evaluating the consequences of our actions, especially when it comes to substance use. In a healthy brain, the prefrontal cortex helps us weigh the immediate pleasure of using substances against the potential negative outcomes. This ability allows us to make informed choices and resist harmful behaviors. However, when someone struggles with addiction, the function of the prefrontal cortex can become disrupted. Chronic substance use weakens its ability to regulate impulses, leading to compulsive drug-seeking behaviors. Different regions within the prefrontal cortex contribute to these functions. The orbitofrontal cortex, anterior cingulate cortex, and dorsolateral prefrontal cortex are all involved in addiction. These areas connect to the limbic system, which processes emotions and rewards. During addiction, these regions can become overly activated when a person is intoxicated or craving substances. Conversely, they may become less active during withdrawal. This imbalance can impair judgment and increase the risk of relapse. Dopamine, a neurotransmitter associated with pleasure and motivation, also plays a role in addiction. It disrupts the circuits in the prefrontal cortex that are responsible for motivation and self-control. As a result, the brain becomes conditioned to associate drug use with pleasure. The craving for dopamine can overpower the prefrontal cortex's attempts to inhibit substance use. Stress hormones further complicate this picture. They can impair the prefrontal cortex's function, making it more challenging to manage stress and control impulsive behaviors. This impairment can trigger relapse, as individuals may turn to substances as a coping mechanism. Understanding the role of the prefrontal cortex in addiction reveals that it is not merely about seeking pleasure. It involves a compromised ability to make decisions that consider long-term consequences. Treatments that support the function of the prefrontal cortex, such as cognitive behavioral therapies and stress management techniques, can help individuals regain control over their behaviors. By focusing on the prefrontal cortex's role, we can better understand addiction as a brain disorder that affects self-regulation, rather than just a failure of willpower.